Akhila, thank you so much for being with us on ITV Gold. I hope you're doing well.
I am, and thank you so much for this opportunity.
Of course, it is so important for all of us to talk about this one topic, which is mental health, its awareness, and wellness on ITV Gold, especially with COVID-19 going on. So I truly appreciate you here for your time on the network. Just starting off this interview, I have to ask you the number one question. There are over 3 million cases in the United States of COVID-19 with over 138,000 deaths. The numbers are so large that it's important for us to understand how we should process it. So my question to you is, according to you, psychologically, how should we process these increasing number for ourselves?
That's a great question. Processing such large numbers is very difficult for pretty much most of us. Maybe some people who are working in that field, in immunology and public health, for them, these have more of a context. But for those of us in the general public, these are numbers that create more anxiety and panic than create any clear understanding of the seriousness of the virus. I think we need to look at these numbers and absolutely be aware of what's happening, the trend of the numbers, and be aware from time to time. But as I tell my patients, it doesn't appear to serve a purpose in relieving the stress, which is why a lot of us look at those numbers in the first place when we're looking at them too often. So I am telling my patients, for example, to limit the number of times that they're checking their phone or watching continuous news shows that are tracking the numbers of cases and deaths, in order to be able to have some peace of mind in between and have a chance to focus on some positive thoughts and positive activities in the middle of that. Although I do think that it would also be a mistake to only do things that are distracting and not pay attention to the numbers at all. That could also be dangerous in not understanding that the virus might be spreading rather than slowing down, or to think that a place that somebody might be thinking of going to or needs to go to is safe, whereas it's not. And one would know that only by looking at certain numbers, but limiting everything in moderation is the advice that I give my patients as well.
Yes, for sure. I think everything in moderation is so important for all of us when we're considering so many things. What have you seen so far as the psychological effect of COVID-19 on new and old patients? Perhaps I'm trying to ask you, how massive of an impact have you seen COVID, come upon these patients that are already seeking help?
That's a great question as well. So in my old patients, those who have struggled at one point or were already struggling prior to this COVID-19 lockdown situation and all the impacts that it's had, those who have been suffering with depression or anxiety or OCD, obsessive compulsive disorder, or Ptsd from traumas that they've experienced in their past, it has, for some of my patients, increased those symptoms or made them recur, whereas they were controlled prior. The symptoms have flared up during this time. For others of my older patients, those who have been with me, it hasn't made as much of an impact, which is also very reassuring. I think one of the ways that if I were to predict who would be impacted out of my previous patients, if they've had a direct impact as far as being isolated because of this, as far as losing a job because of this, losing a loved one due to COVID-19. If they've had these more direct impacts, they have been more directly impacted and have had these flare-ups of these symptoms of different disorders. I've also noticed in some of my old patients who have had obsessive compulsive disorder, I wanted to speak on this for a moment, those who have had that diagnosis and it's been under control for them, I have seen in this time it's flared up because of some of the protocols that we are recommending from the medical community, such as hand washing, maintaining social distancing, wiping down, sanitizing surfaces. And so people with OCD, for example, have certain compulsions or intrusive thoughts. that are very difficult to control. And so trying to adhere to these protocols, some of those symptoms have flared up, as in it's probably gone into an excess. And one more thing I want to say about my older patients is PTSD. So if they've had this anxiety and nightmare and flashback symptomology of PTSD previously under control, the sense of uncertainty that is prevalent today and has been prevalent for 5+ months and counting is really flaring up that feeling of being unsafe, whereas previously they were able to feel a sense of safety in a level of predictability or social interactions. Now with those removed for a lot of people, those symptoms have flared up. And in my new patients, I've certainly seen anxiety as one of the complaints that has brought people in, as well as depression more commonly.
When we're discussing more about this, let's focus a little bit more on the patients, because I want to get more and more information here for people that are seeking help or need more help. We can already see the impact of COVID-19 on mental health. But people that have these illnesses, the patients that you have had, what kind of changes or uncertainties do these people have to watch out for? When you're looking at the impact on their mental health, what should they really be taking care of in order to make sure that they are staying good?
So I think that's two questions. Those who already have these symptoms, if they're noticing worsening, for example, in anxiety, that can present with excessive worry or feeling worried, a sense of fear of what's going to happen where it's not to a point that you can control, or a sense of ruminating, thinking excessively over and over about a lot of things, feeling irritable, having trouble sleeping, having difficulty concentrating, difficulty with appetite can also be part of it because of GI symptoms like nausea or stomach upset or diarrhea or headache, neurological symptoms. Those, if somebody who has had anxiety in the past notices that's becoming a pattern and it's becoming persistent, I would encourage them to seek back out their medical management provider or a therapist that they have been seeing, or establish care with a new person. If it's depression, whether it's old patients, new patients, it's a persistent symptomology of either a sense of sadness all the time, or perhaps not being able to feel anything, a decrease or loss of interest or motivation, trouble with sleep, trouble with appetite. Either way, it can go up or down, decreased concentration, irritability, crying spells. Any of these can indicate that depression has set in. So whereas, and we encourage our population to seek help for these matters when it's affecting your functioning, when it's affecting your quality of life, when it's affecting your relationships. And in order to prevent, so if we're talking about how do we try to prevent these symptoms from presenting, one of the big things that we should keep in mind always, I think, for good mental health is first the basics. So sleeping at a good time of night and getting enough sleep, 7 to 8 hours for most adults, waking up and having some sort of practice, ritual that allows for some relaxation when we first wake up, whether that's, some people like to sit and just read the paper quietly by themselves. Some people like to do a little bit of yoga. Some people like to do a quick run. Whatever it is, having a little time, even if it's 10 minutes, to just sit with yourself and face the day. That's important. Eating healthy food 3 times a day at least, or if you're doing a slightly different diet, making sure to keep it regular. And eating healthy food, foods that boost our immunity, which I can also talk about more later if that's of interest. And also physical activity. So it's very easy because we don't have our usual physical activity and movement throughout the day. A lot of us are working from home. A lot of us are not working. So making sure that we are either taking a walk or, again, yoga is a wonderful exercise and a practice, lifelong practice that one can begin at this time.
Right.
And staying connected to people through phone calls, video calls as much as possible.
Right. What do you advise to the families that have mental illnesses in them? How should they be handling the situation?
I think it's important to know that this is a very different and unique time, but at the same time, we are also living a human life, which has always been the same. So, but in the context of this being a unique time, I think it's important to communicate. It's important for families to talk to one another, for parents to talk to children, children to talk to parents, checking in on parents, checking in on those who live further away, on uncles, cousins, siblings, staying connected. And if you are suffering from any of these symptoms, or you don't know what it is, but you just don't feel good, you're feeling scared all the time, you're just not able to sleep, you're not able to concentrate, I would ask for help. I would encourage children especially to try and bring it up with their parents. I would also encourage parents to be on the lookout and speak to their children. There's a lot of change that's happening. There's a lot of loss that's happening or could happen that people could be scared of. So, for families, I think recognizing that we're all going through this together and that there could be unique manifestations of the impact in your own family members, maybe that you wouldn't even expect. And so especially for our community, for the South Asian community, I would encourage that conversation to be had.
What do you say to people that are grieving right now, families that have lost a loved one? That's a really big pain that everyone has to deal with.
Definitely. So this is a question of grief. Grief is a very open-ended and difficult experience at any time. And I think one of the things to remember for those of us who are trying to help someone grieving is all the ways that perhaps with COVID-19, the grief process has changed. So, for example, if somebody has passed away because of COVID-19, their loved ones have not even been able to be there in the hospital with them. They haven't been able to hold their hands, to give them one last hug, and after that, they haven't all been able to have a proper burial or cremation, whatever ritual that is generally done at the end of life. And people have not, family members, loved ones, friends, have not been able to come together and have that communion and have that peace that comes from that. So what I could say to those who are experiencing grief in this time, especially from a loss of a loved one, would be to do your best to not become isolated during this time, to reach out to your family members, call, talk. Grief is it can present with so many different emotions. It can be anger, it can be denial, it can be just begging, bargaining. These are the usual stages of grief that one talks about. But it's important to remember that there's no particular order. Everybody grieves differently. Some people grieve later. So there's no right way or wrong way to do it. But stay connected, perhaps perform some ritual or ceremony or some action that allows you to commemorate that person, remember them, as well as honor them. Sometimes planting a tree or planting a flower, perhaps, a flower plant, or cooking your loved one's favorite food, or reading from a book that they love. These can be ways to stay connected to that loved one as well as honor the life and person that they were.
Yeah.
And I just wanted to end by saying that for this question that there's a lot of grief, not just for human life, but there's been a lot of loss of the life that we knew for a lot of people. There's been losses of jobs, losses of social interaction, losses of predictability, in a sense. So there's people that are grieving, having the same symptoms of grief for these losses, especially because it's within a context of uncertainty. But at the same time, I would encourage everyone to remember that loss and grief has been part of human life, and unfortunately will continue to be so. So hopefully we can all remember and realize more and more, our true nature and the true nature of the world as well.
Definitely, and I truly appreciate you for sharing so much insight into how to handle grief. I hope viewers watching it could learn some techniques. And just talking about techniques, I have to ask you, we've talked about fear, we've talked about panic, we've talked about anxiety. There is so much that's happening that's impacting us on a daily basis due to COVID-19. Could you help us figure out some techniques or some tips that everyone watching you could perhaps practice on a daily basis to probably reduce this anxiety and this fear and this panic that most Americans are living in, or most of the people in the world are living in?
Sure. So one of the things I would reiterate is that having a routine to your day, even though our routines for a lot of people have been upended, I think, as I was mentioning earlier, so having a routine of good sleep and a good waking time, eating on time, eating enough on time, and sleeping on time, having regular physical movement, exercise of some sort, those are all things that I think practicing our safety protocol, our distancing protocol, we can engage in daily. And I would encourage everyone to engage in these practices, even if you never have, because this is the time that demands that we do as much as possible to boost our immunity, boost our mental health, and these have always been practices for that. I would also encourage those who might be inclined or those who might not be to take a look at yoga practices that one can do from home, to take a look at deep breathing techniques that in the South Asian culture, we have a name for that, pranayama, and there's wonderful techniques in that, which one can explore through videos. We have an abundance of video capabilities, but working on building our lung capacity can give us a sense of safety, like we have another way to control whether we're safe or not, whether we're doing our best or not. So these are some of the immediate techniques that I tell my patients as well and demonstrate for when patients come to me for their visits. And eating foods that are very boosting of immunity will also help us give another sense of control. I think that's the big thing that we lose during a pandemic time is we don't know enough about the virus, we don't know who's going to get it, what's going to happen if we do. And so these are all routine, and these type of practices give us a sense of control that we have. And beyond that, that's the control we have, and that's, as I said, that's the control we've always had, what's in our hands. And also just staying connected socially, so interacting with the people in your house, if you're so lucky to have others in your house, interacting with family members from afar on the phone or video. Now, what I also want to make sure to address that if someone is really struggling and thinking of hurting themselves, of ending their life, I would encourage everyone to make sure that they look up and know and program in your phone the National Suicide Prevention Hotline number, because if you feel like you can't talk to anybody else, I would talk to them and see if they can help you change your mind. Also, if you're really in a sense of emergency, calling 911 is what we tell all our patients. So that is the first, if it's truly an emergent situation, keep that in mind, whether you're family or whether you are the person suffering yourself. There's also cases of domestic violence all across in all communities, and so I don't want to neglect speaking to that. And those are really the silent cases that we don't hear about, because a lot of victims of domestic violence, men or women, do not come seek help right away because of fear, because they're unable to for some reason or the other.
Right.
So there are absolutely hotlines and local agencies that can help with that, which perhaps I can provide to you to share with your viewers after the interview as well.
Yes, of course. Could you display one of the techniques? I know you wanted to do that. I would love for the audience to see it.
Sure. So one of the basic, there's a few pranayama exercises that can increase mental stillness as well as immunity. One of the ones that I can show you today is called Anulom Vilom. And so it's a simple practice. I'll just show you a quick demonstration. So you can take your hand like this. So you basically need your thumb and your middle finger. So you would close your right nostril and breathe out first through your left nostril. So you breathe out and then breathe in through the left nostril to a count of 6. So 1, 2, 3, 4, 5, 6. Then close the left and out to the count of 6. 1, 2, 3, 4, 5, 6. And then you would continue this by doing the same thing, going up the right nostril and down the left nostril. And a good number would be maybe 20 sets, so left to right, right to left being one set. And close your eyes, I recommend, and listen to your breath. Silence is a good environment to do this in, but you can do this even in the middle of a stressful workday or stress of any other kind if you can find a space to do this. Also, Kapalbhati, which is expelling air through your nostrils. It can really help increase the lung capacity as well. So and you can do that as many times as you can endure. It can become fatiguing after a while, but as many times as you can do, and then as you do this every day, your capacity will also increase. And there's many more that I would love to share, but might be more difficult to demonstrate. But if you have a local yoga practitioner who does incorporate pranayama, I would encourage you to use this time to seek out those resources. Or, if you're local to me, I would love to share that with my patients as well.
Of course. Well, I truly appreciate you for sharing those techniques. They're very easy. I'm sure our audience will learn it and hopefully practice it. Akhila, I truly appreciate you for your time here with ITV Gold. I would love for you to give one last message to our audience, perhaps a message to the ones that are struggling in silence right now.
Yes. So, there's so many forms of struggle right now, and I see in the patients that I'm privileged enough to try to help that it is not easy, and it is it's very difficult, I think. So for healthcare workers, let me start there. For healthcare workers who are trying to do their best to save as many lives, to help as many people, there can be a sense of guilt when we can't help as many people or when we don't get the outcomes we want. So I encourage those who are on the front line in various capacities to reach for help for your own mental health, to practice some of these things that we talked about so that we can prevent mental fatigue or moral injury where we have to, be okay with not having the outcomes that we want. Or, and for those who are the, lay people or others, anybody else who's suffering, ask for help when you don't feel well, and it's okay. I know in the South Asian community, sometimes we feel it's difficult to ask for help because we feel it's some sort of judgment on our strength or our intelligence. But let me tell you that everybody can have times in their lives or multiple times in their lives where they need help, and these are unique times, and they're very large impacts on our lives, and even impacts that we don't realize yet. And so if we're not feeling as hopeful and as calm as we want to feel, then there are therapists, there are medication management providers if that's needed, or at least reach out to your own family and friends and ask them what they would recommend if it feels too daunting to reach out to a medical provider, or reach out to some of the hotlines that I mentioned, whether it's domestic abuse, whether it's suicide prevention, whether it's 911, if you're feeling unsafe to yourself or to others. And, use this time, I would say to everybody, whether they're at that level of suffering or they're, still trying to cope the best that they can, I would say this is a time for us all to focus on also going inwards and getting to know ourselves and getting to know what true mental health can be. It can be even better than we imagined. So I would encourage all of us to be aware and seek help and know that there is help if you need help, and know that we're all in this together as well.
Definitely. I think it's important for people to know there is help if they need to seek it. Thank you so much for being with us here on ITV Gold. I appreciate your time again.
Absolutely. Thank you so much for inviting me as well.